All right, welcome everyone. Thank you so much for being here on our Spotlight series for the Best in Utah Pelvic Health edition. And we have Brandi today. She is a fabulous nurse practitioner, and we are going to chat all things about her. And so before we start in on all of our fun questions, I'm going to read her bio so you guys can get to know her a little bit, and then we'll jump into our questions. So thank you so much, Brandi, for being here.
Thanks for having me. I'm excited to be here.
Absolutely. Okay. So, with over 20 years of nursing experience and the last five dedicated specifically to urology, Brandi brings a deep well of clinical knowledge and compassionate care to her role as a nurse practitioner. She's committed to providing high quality, patient-centered treatment while helping individuals navigate often sensitive and complex urologic concerns. Brandi works in close collaboration with two urologic surgeons, partnering to develop and coordinate care plans for patients with a variety of urological needs, including prostate cancer, kidney stones, and overactive bladder. Their strong teamwork and shared commitment to excellence create a supportive environment where collaboration is key and patients benefit from a truly integrated approach. Outside of work, she's a proud mother of three adult children and enjoys supporting her husband in his role as an associate athletic director at the University of Utah. Her well-rounded perspective, both professionally and personally, makes her a valued member of the care team and a trusted partner with her patients. Couldn't agree more.
Thank you.
Yes. So, Brandi, without further ado, let's jump in. And what made you decide to be a nurse practitioner? Tell us your journey. Tell us your trajectory through that and how you arrived at where you're at.
Yeah. When I was young and very what's the word? Ambitious, I wanted to be a physician, and I went to college with that in mind, and I was very involved and headed on that path to go to medical school. And I woke up one day and said, I don't think that's the right path for me. So I last minute decided to apply to nursing school, and I became a nurse, and that turned out to be the very best thing for me to do at that time. It allowed me to be successful not only in the nursing world, but I learned a lot. I made a lot of really great friends, and it helped me as a wife and a mother, and it gave me time and freedom that I probably wouldn't have had as a provider. Um, about 7 years ago, my dad passed away and caused some upheaval in my life, and um, I was searching for some answers and some clarity, and I felt like it was time to go back to school. And obviously, not medical school, but nurse practitioner was actually something that was very similar that could kind of get me right back to that initial goal, right?
Mhm.
And I always wanted to be involved in women's health. I think women are underserved in the medical community. And so I feel like that this opportunity opened up for me to work with Dr. Fisher, and he wanted to have more women, be seeing more women in his clinic. And as a man, not many women seek out that. And so I joined Summit Urology Group 5.5 years ago. And I just feel like the things that we've done and the team that we've built, and then we added Dr. Page. And I think that um, just even my knowledge about women and health and um, how I can help people has just grown exponentially. And I just love everything about the urology world. It's weird. People ask me all the time, why would I want to do something like that? But I think that I love it because I can make a difference in women's lives and men's lives. I can be a sensitive listener. I'm not a child anymore. I'm a grown woman with lots of experience, and I think that just, life experience tends to make you a lot more sensitive when people are talking to you about very personal, private things, and that's what we do in urology. I mean, those are things that people just don't want to talk about, and I think that they know that I get it, and they want to tell me because they can see that I really want to help them.
Totally. Totally. And you kind of hit on the next question I was going to ask you of what makes you different. And that some of those things are very true in that. Is there anything more you'd like to add to what makes you different than a regular old nurse practitioner?
I think that what makes me different is that I just have so much nursing experience. I mean, I've been in the medical field since I was 19 years old. And I'm not 19 anymore. I turned 51 this year, so I've been doing this a very long time. And
Wow.
I think that, you know, my experience ranges from home health to nursing homes to high level ICU care to urgent care and surgical interventions. So I just have so much experience, and I've worked with, and I've lived in a couple of different places. I've lived in Southern California and Utah, and I've just kind of been through this whole, you know, transition. Healthcare has changed a lot in the last 30 years, and I've just been able to kind of roll with that and stay with it and still love what I do. And so I think that that's what makes me unique, is just the vast experience I have. I mean, I literally have more medical field experience than both of the physicians I work with combined.
Yeah,
So, you
yeah.
know, because I didn't have all that time in med school, right? So I have
Mhm.
more practical, hands-on experience that just, I think, you know, and when you take care of people in their homes, that's kind of where I started as a home health aide. Um, you know, people trust you if they let you in your homes. And I think
Mhm.
that I've just been able to develop that relationship with patients when they come see me in my office. They realize that they really can trust me. So
Amazing. I love that. Okay.
thanks.
Thank you so much for sharing that.
Mhm.
Walk us through who's an ideal fit for you. Like if a patient is watching this and they're like, "Oh, I think I need to come see Brandy." Who is that person? Symptoms are they having? What kinds of procedures do they need? Walk us through who's an ideal fit for you.
Okay, so we do quite a bit in our office, like you said. The main patients that I see are well, surgical, because we're a surgical specialty, right? And if
Mhm.
I can help you surgically and fix you, I want to do that, and I want to do it fast and effectively and get you back to your optimal health. But I also um, really have a connection with these patients that I see, and mostly women who come in and have been to multiple multiple providers, right? And nobody has an answer for them, and they tell them that it's all in their head and that they're crazy. And I can sit down with those women and hand them a box of Kleenexes, and we can kind of power through some of the things they're experiencing. Some things would be chronic urinary leakage, or chronic pelvic pain, or UTI symptoms that never grow a culture, right? Those are some people that I can talk to and sympathize with and really help them. And, you know, if you've got a kidney stone, I can help you with that too, right? If you've got kidney cancer, if you've got bladder cancer, if you've got prostate cancer, those are all things that we treat in our clinic. And, but again, I think I really connect with those women that are like, um, wow, I've just been through so much and nobody believes me. And they come in and they pour their heart out. And I'm like, I believe you. I have a plan for you. Let's get to the bottom of this for you. And I think that that's what really, that's who I connect with. And that's who I want to see in my clinic, is people that want to be vulnerable, but also want to be helped. So,
Yeah, totally. Love that. Thank you for sharing.
mhm.
Kate, walk us through the process of what it's like to work for you. Does someone just call the office? Do they have to set up an appointment? How do you have a wait list? Do you take all insurances? Like, what does it look like to set up an actual appointment?
Yeah. So I work for Granger Medical, which makes us unique because then we can take pretty much all insurance providers, right? There's a very few that we don't accept. So if you have View Insurance, we accept that. If you have Select Health, we accept that. United. Oops, sorry, my dog's next to me. um, we take most insurance providers that are available in Utah, which makes me unique in that. And I accept the same insurances as all the providers in Granger. We're all credentialed the same, which is a real advantage, right? So if we need to share patients or um, refer to specialties within Granger, that's a really nice option. Um, I'm not a walk-in clinic. We are a specialty clinic, and so you need to have an appointment. I tend to be about 4 to 6 weeks out, unless it's an emergency. If you've been seen in the emergency room, I do leave appointments open for emergencies, especially when the week after the docs I work with are on call. So I do have emergency slots available. I work 4 days a week, Monday through Thursday, only a half day on Tuesday just for my mental health. But we have a great office team that helps get people in. And, you just call them Summit Urology in Sandy. That's where my office is. It's located in Building 5 of Altaview Hospital. We rent that space from them. And we have a beautiful new office that we love there. But you call, you get an appointment. And again, I don't typically see things that are emergent unless it's a surgical emergency. Most of the things I see can be managed chronically, and we can really, dig in deep and figure out what's going on and see how we can best help you.
Awesome. And I can attest to that. I loved when I came to your office. Everyone there was fabulous. I was blown
Yeah,
away. I was like, these people are awesome.
yeah,
So,
it's such a great
yeah,
team to work with.
really
We
great team.
family and we love it.
Yes, yes. Okay. This question I really like asking is what's something that most people don't know, but that you think that they should know about your services?
Um, Gosh, that's a tricky question. I think that people get in their mind that urology is only for men and we only do testosterone and ED and prostate health. And I think that I guess if I could change anything about the way people think or feel about urology, I would love for them to see it as everybody has kidneys and everybody has ureters and everybody
Mhm.
has a urethra, and we all have to urinate because that's how we get rid of waste. And so I think if we could all see each other a little bit more equally in the urology world, that women should realize that there is a space for them in urology. The physicians are trained to take care of men and women. Um, Not all of them choose to do all of the things in urology, but in my office, I'm lucky to work with two really great physicians, and especially Dr. Fisher, because he loves to do female surgeries like slings and sacrocolpopexies for prolapse, and surgeries that are life changing for women, right? And
Mhm.
I think that women just think, well, I'm just getting old, there's no option for me, or I have to go to a gynecologist, when really, I can help you in urology and I want to.
Totally, totally. Love that. Thank you. Okay, is there anything special you want to promote, whether that's like an event coming up or something that you want to promote for health for the viewer watching this of like anything that you're like, here's my like 2 second plug for something. I've had people say like an event, I've had people say like focus on sleep or like some health tip that you would recommend. Anything and then everything is fair game.
Okay. I don't have any events coming up. I wish I did. That would be fun to promote something. Um, but I think what I really want women to know is that um, don't believe everything you get told in the doctor's office. Do research, be an advocate for yourself. Um, and don't take drink more water and wipe front to back as an excuse, right? Like that's
Yep.
not a that's
Yep.
not an answer, and that's the wrong answer. We're grown women, we know how to wipe. I think that's that's my biggest pet peeve. Women know, we know what to do, right? And I think trusting in ourselves as women and knowing that we know our bodies and
Mhm.
really pushing you know for that care that you deserve, right?
100%.
And I think
100%.
that, if you come and see me, I'm going to tell you, listen, I'm going to tell you what I do, but if it's not working, I'm willing to try something else.
Mhm.
Or if I can't help you, I'm going to help you find help. I'm not afraid to refer. I'm not afraid to ask questions. I'm not afraid to team up with someone else. So I think just, I'm all about girl power. So I just think be an advocate for yourself as a woman and, step out there with confidence and ask for what you need.
I love that. Yes. Amen to all of that. Yes. Okay, this is one of my favorite questions to ask everyone, and it is, what is the main thing that you want to be known for?
Well, I really want to be known as a great mom, but I feel like with adult kids, I've already kind of got there. So I'm grateful that my kids really love me and appreciate me. But I think that I also want to be known as somebody who people can trust. I think I've alluded to that a little bit as we've been
Mhm.
talking today. Um, but I want to be known for my ability to listen, my ability to sympathize and understand, and just that I'm trustworthy to tell your deepest, darkest secrets to, and know that I'm really going to sympathize and empathize and then help you find a solution.
Amazing. Love that. Love that. Thank you, Brandi. Where can we find you? Obviously, Granger Medical Summit Urology
Yes,
Altaview. Is
yes.
there a website? Is there a phone number? What's like any other information that we
Yeah,
can share with the
so
audience?
Granger Medical has a website. You can search me up as a provider.
Perfect.
I mean, I can give you my phone number now. It's 801-571-5121. That's my direct office number. And that's how you would call and schedule an appointment. But if you want to see my reviews or my bio again, if you want to read over that, that's all on Granger's website, along with reviews. And of course, we get Google reviewed, which I don't love, but our office actually got awarded the State of Utah Award for having some of the best reviews. And 2 years ago, I think I was one of the top reviewed female
Congratulations. That's
providers. So,
amazing.
I mean,
Yay.
not everybody loves me, but most people seem to think I do all right. So, so I
She's
feel okay about
amazing.
that.
Everyone,
Yeah.
Brandi is amazing. I can attest to that. Okay. Thank you so much for your time. Thank you for doing the Spotlight series with me, and thank you for all that you do in the community. It's a huge blessing. So thanks so much for being on here.
Thank you. It's been great to spend time with you. I appreciate it.
Yes.